Hello everyone, today let's learn about rheumatoid disease. This is our group members in this video. First of all, what is rheumatoid disease? Rheumatoid disease or rheumatoid arthritis is an autoimmune disease where the immune system mistakenly attacks a healthy body's tissue for foreign invaders. This results with inflammation, swelling, and pain in and around the joints which eventually cause bone erosion and joint deformity. Besides joint, it can also affect other parts of body organs, for example include heart, lungs, and eyes. In Malaysia, rheumatoid arthritis affects about 5 in 1,000 people. It can start at any age from childhood to those within the 90s. The most common age of disease onset is between the age of 30 to 50, and this disease is more remarkable in women compared to men. Now, let's move to the etiology of rheumatoid arthritis. The cause of rheumatoid arthritis remains unknown, but there are several factors which increase the risk of rheumatoid arthritis. The first factor is genetic. The risk of developing this disease is associated with a gene called class II HLA genotype, for example HLA-DRB1 04, 01, and 10. A study found that monozygotic twins had higher concordance rates than dizygotic twins. Second factor is smoking. Many studies have shown that smoking increases the risk of getting rheumatoid arthritis. It also can worsen the disease, especially if people have a genetic predisposition. Third, gender. Both genders are affected. Women are 2 to 3 times more likely to develop rheumatoid arthritis than in men. For age, rheumatoid arthritis can occur at any age. The incidence of this disease is highest in adults in their 60s. Next, family history. People with a family history of rheumatoid arthritis, about 5%, have a significantly higher risk of developing this disease than people without a family history. The last factor is obesity. Overweight people are at risk of developing rheumatoid arthritis. Next, we are going to talk about pathophysiology of rheumatoid arthritis. There are several symptoms and signs of rheumatoid arthritis. The first one is fever. The inflammation associated with rheumatoid arthritis leads to raise the temperature in the body. Next, unexplained weight loss. Fatigue and fever lead to loss of appetite, resulting in loss of weight. The weight loss is also an indirect effect of inflammation. The third one is joint pain, which is a pain in more than one joint at the fingers, wrists, or feet. This is due to the inflammation that has made the lining of the joint thicker and led to the production of more joint fluid. This creates pressure on the capsule that surrounds the joint and irritates the nerve endings that it contains and results in more joint pain. Decrease the range of motion. It will be difficult for the person to bend the wrist back and forth due to the joint damage, and it also affects tendons and ligaments. Numbness and tingling. One will experience loss of sensation due to the nerve compression caused by inflammation in the joint. Fatigue or tiredness is also a symptom of rheumatoid arthritis. They will feel extremely tired and have inadequate energy, which affects their productivity. It also may be caused by the body's reaction to inflammation in the joint. Other than that, the signs and symptoms of rheumatoid arthritis are joint swelling and joint stiffness. Next, the stages of rheumatoid arthritis. There are 4 stages, and we're going to explain what exactly happens in each stage. In stage 1, the joints start to have problems such as pain, stiff, or swell. This is due to the presence of inflammation inside the joint, especially on the joint lining called synovium. The tissue in the joint is swelling as well, but however, there is no damage to the bones observed in early stages. Next, Stage 2, which is a moderate stage for rheumatoid arthritis. The joint cartilage is damaged because of the synovium's inflammation. This leads to pain and loss of mobility because of the limited range of motion in the joints. For stage 3, this stage is considered a severe stage as the damage extends to the bone instead of cartilage. The bone will rub together due to the cushions between bone have worn away, resulting in more pain, swelling, muscle weakness, and more mobility loss. Lastly, stage 4. It is also known as the end stage of rheumatoid arthritis. The inflammation in the joint is stopped and the joint is no longer working. People diagnosed with stage 4 will experience pain, swelling, muscle weakness, and mobility loss until this stage. Other than that, the muscle strength is reduced, joint become destroyed, and the bone fuse together, or known as ankylosis. The question is, how it is diagnosed? In early stages, it may be difficult to diagnose because the early signs and symptoms mimic many other diseases. There are 5 ways to diagnose rheumatoid arthritis. First, seeing a general practitioner. Second, blood test. Third, rheumatoid factor and anti-CCP antibodies test. Fourth, joint scans. And lastly, assessing physical ability. Moving on to the management, there are medical management as well as nutrition and lifestyle management. Medical management. In terms of medication, doctors will recommend the types of medication depends on the severity of the symptoms and how long the patient had rheumatoid arthritis. The medications include non-steroidal anti-inflammatory drugs, or known as NSAID, steroid, conventional DMARD, and biologic agents. First one is NSAIDs. It can relieve pain and reduce inflammation. NSAIDs include products like ibuprofen, naproxen, and aspirin. However, taking NSAIDs make you get stomach irritation, kidney damage, and heart problem. For steroid, corticosteroid medication such as prednisone reduce inflammation and slow joint damage. It helps to relieve the symptom quickly. For the side effect, it may cause weight gain, thinning of bones, and diabetes. Meanwhile, conventional DMARDs slow the progression of rheumatoid arthritis by modifying immune system and save the joints from permanent damage. This is the example of common DMARDs used. The side effects vary, but may include severe lung infection and liver damage. If a patient does not respond well to DMARD, doctor may prescribe biologic response agents which target the molecules that cause inflammation in the joint. Biologics are more effective because they attack the cells at more specific level. They're usually more effective when paired with a conventional DMARD like methotrexate. These are examples of the products. Now let's take a look at nutrition and lifestyle management. First, drink plenty of water. According to Malaysian dietary guideline, we should drink 6 to 8 glasses of plain water in a day. It is recommended to drink warm water as it could help to move blood through tense muscles and joints, as well as loosening synovial fluid and allowing joint to move more freely. Next is by consuming a wide range of nutrient-dense foods. A dietary choice aids in reducing inflammation in the body, giving nutrients required by the body, and maintaining a healthy weight. For example, antioxidant-rich food like berries help to reduce free radical damage to joint linings and reduce swelling and pain. Other than that, omega-3 fatty acids in fatty fish like salmon and mackerel have been shown to have powerful anti-inflammatory effects that reduce joint pain severity. Furthermore, be physically active. Be physically active for at least 30 minutes each day for 5 days per week. People with arthritis should begin with a low level of movement and joint-friendly physical activity such as walking, biking, and swimming helps to improve arthritis pain, function, and quality of life while reducing injury. Lastly, avoid or stop smoking. Smokers have high amounts of cytokines, which are inflammatory substances. Tobacco smoke causes the body to release a variety of cytokines connected to inflammation, which aggravates rheumatoid arthritis. Therefore, smoker patients are advised to use nicotine replacement therapy to help them quit smoke. There is a lot of interest in the role of diet and nutrition in symptom management for rheumatoid arthritis, but there is no comprehensive research on the topic, nor is there a dietary formula to fight rheumatoid arthritis symptoms. One of the few that could be taken into practice is consuming anti-inflammatory food. The examples are fruits and vegetables, legumes, and olive oil. The next suggestion is to maintain portion size as recommended by Ministry of Health, known as suku-suku separuh. The third suggestion is to avoid any processed foods as it is high in sugar, carbohydrate, and saturated fat. Next is to apply a Mediterranean diet, which is a diet with high in seafood. Lastly, people with rheumatoid arthritis are advised to avoid fried foods. Instead, use air fryers and choose baked foods whenever possible. These are all the references we use in this video. That's all from us. Thank you for watching.